I think it would be fair to say that our most critical need at this time is for skilled personnel. The funding is generally available, the medications are available, the equipment is available. It's the hands to use it to the benefit of the patients that we need.
The rural public hospitals of South Africa really give you an opportunity to get involved, hands-on, and make a significant difference in people's lives. Because if you're not there, the chances are there wouldn't be anybody there. Africa Health Placements recruits foreign and locally qualified doctors and nurses to rural positions in rural hospitals around South Africa, where the need is huge.
I think we are a mini United Nations here.
My name's Tom Gorsuch.
My name is Casper.
My name is John Berggren.
My name is Dr. Obio Enso.
My name is Graham Cookon.
I'm Cara Frinney. I'm a doctor from
Alaska.
A Dutch tropical doctor, disease specialist trained in the UK.
Did my undergraduate training in Belfast at Queen's University.
I've been working here for 2 years.
I trained in the UK and I've been working there for 5 years since I qualified.
A background in family practice in the States, and have been practicing for about 14 years in rural settings in the United States.
I did 6 extra months of pediatrics and have since come out to work in Africa Centre.
I'm presently Principal Medical Officer.
At the end of December, we were left with 2 doctors. This is a 300-bed hospital with 16 clinics and with about 7 or 8 mobile points, right? And the catchment population is 220,000. And you've got 2 doctors to look after 220,000.
I think South Africa is probably unique in being a place where there's a vast amount to be learned in terms of clinical experience, but also there are the resources behind it. So it's possible, for example, to arrange CT scans and for patients to be seen by thoracic surgeons if that's what's required.
Facilities here are limited to some extent, but in terms of the basics of what we need to do, basic resuscitation and surgical facilities are really quite good. Again, basic, very limited formulary, very limited equipment, but what is here is good and functional and able to do the things that we need to do. It's definitely not third world medicine here. I mean, there's really a fairly high level of care.
The typical range of clinical experience is vast, right from obstetrics and anesthetics to surgery.
In our underprivileged hospital, any pair of hands will do something. So when our graduates come over, they catch on very quickly. Within weeks, they are surprised themselves. They've got to be a generalist. And as such, they must be able to do everything.
You will do any and everything if you allow yourself to grow and to push yourself. There's a lot of experience to be gathered here.
In my calls, I'm helping out with cesareans.
We see surgical, we see trauma.
Pleural aspirations, chest drains, which I do most days.
I do lots of debridements, I do skin and lymph node biopsies.
Things like lumpectomies.
Drainage of abscesses and minor suturing of wounds.
Ectopic pregnancies.
Lumbar punctures, I've done an average of about 1 a day, which is obviously far more than I'd be doing in Western Europe.
I've been doing larger operations, as in amputations of limbs.
There's a real premium on obstetrical skills. We deal with the high-risk stuff, the failure to progress, dystocias, and the need to execute a surgical delivery. It's also basic anesthesia. Even the younger doctors that don't have much anesthesia experience, they can gain it here, and it's strongly encouraged because if you're on call with one other doctor, there's 2 of you. One needs to do the anesthesia, the other needs to do the cesarean.
The amount of work that you can do depends on what you're prepared to do, essentially. If you want to learn to amputate a leg, then you can do it. If you want to do general anaesthetics, then you can.
Now, if you've never done anything like that before, let me assure you, you can learn. You can learn very fast, and you can learn under the supervision of more experienced medical officers.
We don't really have any consultants in this hospital, but we get a lot of help from Nguelezan, the hospital nearby, and these consultants are great.
Because this is a general hospital in rural South Africa, there are no specialists here except on occasional visits. But there's a very good relationship that I have with my colleagues, and we always discuss problems, and it's very easy to ask for phone advice for nearly everything. There's a specialist at the end of a phone if you need to ask for advice.
Except for the odd occasion when the landline wasn't working and you had no cell phone reception. But you can deal with it.
Generally, I think part of the appeal of working in a hospital like this is the wide spectrum of pathology and management conditions that you get experience with and need to know.
The chronic diseases like hypertension, diabetes mellitus, asthma, malnutrition with children, HIV and TB.
In summer, we face a lot of insect and snake bite. They are so common that we know the treatment just like that.
Quite a lot of tropical diseases, malaria.
We see some oncological disorders too, and with some secondaries too, presenting with complications. Breast cancer, CA uterus with secondaries.
English is the lingua franca of the hospital settings, there's no doubt about that. But I would say 90% of the population that we serve here in Eshowe do not speak English.
All the foreign doctors, because of the issue of language, therefore always be somebody who will translate for the doctor.
Until such time the doctor is able to communicate with the people himself, yes.
I've really only learnt a few phrases: sit up, lie down, take a deep breath, do your feet hurt, can you walk? Things like that, which you have to use in a consultation, and if you can say and understand the replies, then it saves a lot of time.
For more detailed history and information, we need the help of a nurse, and there's usually somebody readily available to help out.
I think security is an important issue, and the important thing is not to listen to any South Africans about security, because they're always likely to scare you.
The fear of crime is a South African obsession, like the British are obsessed with the weather, which is understandable. I've been to places in Durban, for example, where I haven't felt safe at all, and you have to accept local advice and just to ask people around you.
I spent a lot of time out in the roads, riding my bike and these sorts of things. Initially, I was a little bit weary of just being out there all by myself, but I really have found it to be a very safe and secure place. People are extremely friendly, actually, is what I've found, especially in the rural parts.
You have to be sensible, and so driving after dark in places where there's no traffic, for example, are generally to be avoided.
Well, believe it or believe it not, people from Durban, anytime I say to them that I live in Matuba, if I'm ever down in Durban for the weekend, they all go, oh, shame, because they think it's terrible, but I actually am happier to be in Matuba than I would be if I was in Durban. Maybe I'm a country girl rather than a city girl, but personally I like it here.
Hlobisa is a small town quite deep in the middle of the countryside. It's about 60 kilometres to the nearest town, Matuba, which has some shops, but the best shops are in Richards Bay, which is about an hour's drive away.
The area here, it's nice, it's peaceful, there is no traffic, of course.
It's a laid-back environment, if I may say. I was born and grew up in the cities, and I found this change of environment quite an interesting and a calming one for my personality.
It's 40 minutes away from Cape Vidal, which is the UNESCO World Heritage Site, actually. It's a beautiful beach.
There's one of South Africa's most famous and best game parks, the Hluhluwe Mfolozi Game Park, which you have to go through to get here. So it's one of the places where you can use the excuse that there have been elephants on the road to explain why you're late for work, and that's pretty useful at times.
We have a Madikwe Game Reserve that they like to go to.
The Drakensberg as well is a mountain range. We've been doing hikes and treks up there. Plenty of activities to do outside work, probably more so than home, to be honest.
Rural hospitals are isolated, and some people might think that you'd be out of the academic loop when you're in South Africa. Let me say that there are lots of opportunities available.
It's not only work, work, work. They can also look at their own career pathing. Although it's a rural area, they do go out to tertiary institutions, meet colleagues there, and there's symposia that they can attend. There's workshops that we send.
There are a number of bodies that are busy doing this, including the Foundation for Professional Development, which runs ongoing courses in HIV and AIDS and antiretroviral therapy, and a host of courses in emergency medicine.
I think most colleagues who are coming from overseas, they don't know what to expect when they come to rural South Africa. I think we have to reassure them. We won't be staying under trees or on top of trees. They'll have accommodation. The hospitals provide apartments, right, at a minimal cost.
Accommodation, so-so.
The facility does have accommodation that can accommodate about 3 families.
Not necessarily free of charge, but with a nominal fee for water, electricity.
The accommodation is within the hospital ground, less than sometimes 100 meters from your ward. You just get to work, take a walk, and you come back. Definitely South Africa is way ahead as far as salaries as compared to other African countries. In a rural hospital, beside your basic salary, you get 22% extra for being in a rural environment and another 15% for being scarce skills. Most of the colleagues who are here, because their expenses are low, they're able to have holidays every 2-3 months. I've got colleagues up here who saw more of the country than I saw.
The sense of being part of a team, both within the hospital and also the sense of a community outside the hospital, is extremely strong. And that's often what people remark on when they come to South Africa, and why they find it very difficult to leave, actually.
Oh, the people here are very friendly. That's why our doctors, when they have to leave for somewhere or for studies or for transfer, they really, they really cry.
Usually when people have spent time here, that's one of the things that people often comment on, that it's really been a positive experience for them. When they leave, it's one of the number one things they say they're going to miss. It's not so much the professional interaction, but the teamwork and the relationships, the sense of community. I think often people from big cities haven't experienced that sense of community before. That's really part of our life here.
Salagatle.
Salang sentle.
Salani kahle.
Salang sentle ba gaetsho.
Salagape.
If there was one piece of advice I would give a junior doctor coming to work here, it would be to understand that your job here is to do the best you can within your abilities. And as long as you come with that attitude, you'll come away with some great experiences. You'll certainly have learned a lot. I think it will be something that will help you mature as a doctor. It's extremely important.